This is America, and this is a clinic in Washington, D.C. that's known for helping people who fall through the gaps in the American healthcare system. There is an increasing number of them. As insurance costs rise, many people are being pushed out of healthcare insurance altogether. We'll look at the social and political implications of that in a minute, but first let's go to Rob Matheson in our Washington, D.C. studio.
Thanks, Richard. Well, healthcare in the United States is a complex patchwork of public and private and partially funded systems. The one thing they all have in common, they don't come cheap. Now, there was a plan to help alleviate that pressure many years ago. It's called the Affordable Care Act, aka Obamacare. The idea was to give more people access to health insurance and to cut the costs of medical support. But for many of America's most vulnerable people, health insurance is now so out of reach, they're going without. So what's changed? And why are millions of people giving up health coverage completely? Here's Alex Baird to lay it out.
Most Americans get their health insurance in one of three ways: through their employer, through government programs like Medicare and Medicaid, or through the Affordable Care Act. That's the one they call Obamacare. But around 27 million people across this country have nothing. That means any health care they receive, they have to pay for up front. So what would that mean for me? No, how about two me's? I'm insured through my employer, and I have nothing. And let's assume we both live in Texas, which has the highest uninsured rate in the country. Nearly 1 in 5 people have no insurance at all. Let's say we both get hit by a car, leg badly broken, and someone calls an ambulance. We're taken to the ER, get surgery, stay at the hospital overnight, the exact same treatment in both cases. The whole experience is racking up bills. With an injury like this, we're talking tens of thousands of dollars worth, according to non-profits who monitor healthcare. I now have to pay all of this out of my own pocket. Luckily, I have coverage. Not only that, but my insurer gets a pre-negotiated rate, so my bills are actually cheaper. Now, in most instances, I'm charged a copay. By law, that's capped at $10,600 for an individual per year. So realistically, I'll likely be paying a few thousand, but that's still a lot of money. Same state, same broken leg, same surgery. But one version of me is now tens of thousands of dollars in debt. That's the reality for millions of Americans, many of whom have hospital bills worth hundreds of thousands of dollars that they'll never be able to pay back.
So you get an idea of the complexities and the layers involved when it comes to navigating America's healthcare system as a patient. But there's another element, navigating the system as a voter. Healthcare is always top of the agenda for politicians. Each has a different idea on what's wrong and how to fix it. Now, we hear a lot about Obamacare, which has been around for 16 years. So what does the current president have to say about it?
The disaster known as Obamacare.
We repeal and replace Obamacare.
Repeal and a replace of Obamacare.
Repeal and replace the disaster known as Obamacare.
Obamacare, which has failed.
Why is Obamacare so bad?
Obamacare gives you terrible health care.
I had a choice to make. Do I save it and make it as good as it can be, or do I let it rot? And I saved it. I did the right thing.
Well, the reality is that the rising cost of health insurance is only going to put more stress on the overall health system. It's bound to raise concerns about health costs ahead of the midterms later this year. Richard Gaisford takes a look at the politics behind public health.
There's often a cost to staying in good health in the United States, and the number of people who can't afford to is rising here. The insurance-based health system funds care for those who can't afford a policy, alongside the extra payments that come on top of their premiums. It's hard to find anyone in the street happy with the situation.
It's extraordinarily expensive, and there are long wait times, and it's a very unequal system. It's unfair.
I've just taken my mother to the doctor personally. She's 74 years old, and they needed a $50 copay. $50 that I had to pay out of my pocket in order for her to be sane.
I've had no health insurance, and I've had to have emergency, healthcare costs. Cost me upwards of $5,000-$10,000 fresh out of grad school. So, it affects everyone, whether you're a working class citizen, you're poor, or if you're just not part of the 1%.
I'm really afraid of the changes that will probably come.
Relief subsidies introduced in the pandemic expired at the end of last year. They'd helped lower-income families pay for health care. Since then, federal data shows enrolment for Obamacare has fallen by more than 1 million people. Analysts say the number could go higher by the end of 2026, marking the first fall since its introduction.
It's a great bill. There is something for everyone.
The non-partisan Congressional Budget Office estimates the One Big Beautiful Bill Act, passed by the Republicans, will reduce federal Medicaid spending by more than $900 billion over a decade. It's Medicaid that protects the most vulnerable and will now have new requirements to work for some recipients. At the same time, the cost of insurance policies has risen dramatically, pricing many out of the market. The uninsured rate for Americans under 65 is now close to 10%. That leaves around 27 million people without health coverage.
Republicans have taken $1 trillion out of the healthcare system and ripped healthcare away from 15 million Americans, all to give tax breaks to the billionaires.
Healthcare provisions, another key midterm election battleground.
They caused premiums to skyrocket, and now they have the audacity to tell Republicans that the only way to save it is to throw hundreds of billions of dollars to health insurance companies, which would merely fuel a system that is rife with fraud, waste, and abuse.
Pressures building on politicians, with hospitals warning of a growing financial strain, not just in dealing with the uninsured, but also insurance companies whose payments don't always cover their costs. Less wealthy rural areas in particular are seeing hospital facilities close.
Moms now have to travel for labor and delivery.
More than 100 shut in the last decade, with researchers saying more than 700 are now at risk across America. Richard Gaisford, Al Jazeera, Washington.
I want to introduce our guest, Alice Miranda Ollstein, Senior Healthcare Reporter at Politico, and Leighton Koo is Professor Director of the Center for Health Policy Research at George Washington University. Thank you both so much for being with us. Leighton, I want to come to you first because we heard earlier on, even Donald Trump eventually admitted that there were elements of Obamacare that were successful. And yet, as we're talking about, millions of people seem to be leaving the system, or in some cases are being excluded from it. Wasn't it the case that Obamacare was supposed to be the thing that solved everything?
Obamacare wasn't designed to save everything, but certainly made a lot of progress. And so part of the thing that's regrettable is that we knew some of these changes, such as the expiration of the tax credits that just happened. We foresaw that. We knew that for more than a year this was going to happen. And Congress and the Trump administration refused to do anything about it. So we've fallen into this trap now because, in large measure, conservatives hated the Affordable Care Act so much.
Alice, the key thing that we have to remember here is people's lives. And this might be a slightly ridiculous example, but I think you'll understand why I'm asking you. Say there's a farm worker in Utah. They break their leg. They can't go back to work. They don't have health care. Can you just talk us through what kind of impact that may have on their life and what the system, if anything, has to provide for them?
Yes. So I think what we're seeing right now is not a massive cost savings, but a massive cost shift away from the government spending onto individuals and hospitals and clinics who are having to pick up the tab for people who find themselves in the need of services and then can't pay. And so you're seeing a lot of concern that that's just going to go up and up and up because these subsidies went away and people felt that they couldn't continue to keep paying for their insurance and just dropped it all together. Now, I think we also want to pay attention not just to the people who are newly uninsured, but also people who are underinsured. So in addition to the massive rise in people who are foregoing healthcare altogether, you have a lot of people shifting from more comprehensive plans to cheaper but very skimpy plans that may not be there for them when they really need them and cover what they think they should cover.
And nevertheless, they're expected to pay, they're expecting that they should be paying out money for those plans, but if you're, as you were saying, they may not cover what they require. To pick up on something that Alice just mentioned, so if somebody doesn't have health insurance, it's most likely that they're going to go to an ER, but that's going to have, I would imagine, an impact on the hospital, the medical facilities that it can provide, the staffing, and so on. Can you just talk us through the kind of knock-on effect if there's this sort of increased pressure on ERs?
Sure. Because people don't have insurance, they may turn to emergency rooms or sometimes other safety net clinics, community health centers. And so if they don't have insurance coverage, there's a double whammy for these places. Not only do they now see that they're going to get less revenue, have less money to pay for their staff, less money to pay for medicine, but in addition, they're likely to see an increased demand. So they're going to see more patients coming in saying, I need this help, but I can't pay for it. So it creates tremendous pressure that in the end, everyone, including people who continue to have health insurance, will pay for.
Alice, if I understand it correctly, there is also a circumstance now that people can be removed if, say, their paperwork is missing or if there is an administrative error or so on. As we're seeing so many people who are leaving the health system, what are the risks also that people are just going to fall through the cracks?
So that's sort of always been the case, but it's expected to increase, especially starting next year when work requirements for some people in Medicaid, not everybody in Medicaid, but for some people in Medicaid, they will have to start proving that they've either worked a certain number of hours per month, volunteered, went to school, cared for a relative. There's all these categories. One, that's a lot of burden to put on states to figure all of that out for all of these tens of thousands of people, in each state. But also, it's a big burden on the individual. And you have people who, they may not have access to the internet, they may not have a cell phone, they might not even know these rules are going into effect until they show up at a clinic one day and are told, sorry, you're not insured anymore. And I also wanted to highlight something Leighton said, which is that this is going to hit even the people who maintain their insurance. And because if the only people in the insurance pool are people who have a lot of health needs and need to keep paying for their insurance no matter what, they're more sick, they're maybe older, that's going to put their premiums way up. And so having people who are maybe younger, maybe healthier, maybe don't have as much money drop their insurance, that's really going to have these spillover effects.
Yeah, I want to pick up on that point because we have to highlight there was a big change, of course, that happened in the US earlier this year, and that did send insurance costs way up. During the pandemic, the government granted nearly everybody a big discount on health insurance through Obamacare, as we've just been talking about. Now, that ended in December, meaning less financial help for lower income earners. For those making more than $62,600 a year, that financial aid vanished completely. Let's take that example of a middle-income earner. It works out to just over $5,200 a month before tax. With those pandemic-era government subsidies, an average monthly premium payment is going to set you back $113. Now it's $178. Then there's the deductible, the minimum amount you've got to pay before insurance takes care of the rest. With subsidies, you're going to look at an average of $2,759. Now, it's up to more than $1,000 to $3,786. Now, many people are having to decide between paying for healthcare or buying basic necessities. John Hendren's been meeting one mother who's has to make that choice every day.
For Vanita Coleman, healthcare isn't a political debate. She's lost her coverage for herself, her husband, their 5-year-old son, and their month-old daughter. She's struggling to balance housing costs, groceries, diapers, and everyday bills. And she says every month feels harder than the last.
It's very, very expensive. Diapers definitely done raised up. Clothes definitely done raised up a lot. Food, formula is high.
Vanita once had coverage through the federal Affordable Care Act marketplace, but she can no longer afford it. So today she relies heavily on community clinics and support programs to help keep her family afloat.
If I didn't have these programs like how they do out here, I would probably be struggling. Literally, like how most people are these days.
Her experience reflects a growing national problem. The enhanced federal health care subsidies created during the pandemic expired at the end of the year. Since then, insurance costs for many Americans have jumped.
Here in Oakland and across the U.S., the Affordable Care Act is growing less affordable. According to new federal data obtained by the nonprofit group Notice, 21% of Obamacare recipients this year lost coverage after they failed to pay their first bill. That's 1 in 5. Enrollment nationally appears down by millions. A new survey from KFF, a major nonprofit organization focused on health care and public health issues, finds 80% of those who kept Obamacare say their costs have increased significantly. More than half say they're cutting back on food and household necessities to afford health care. Nearly 1 in 10 now say they can't afford it at all and are now uninsured. For families like Vanita's, it becomes a matter of priorities, paying for health care or paying for everything else.
I would struggle. It would definitely be a struggle. I would really have to come out of pocket.
Healthcare affordability is emerging as a political issue heading into the midterm elections, with many voters saying rising medical costs could influence their vote. But for many families, the concern is more immediate. Just getting by one day after the next without a healthcare emergency. John Hendren, Al Jazeera, Oakland, California.
Okay, so Leighton, John was talking there about the impact that this is also going to have, of course, in people still continuing to pay premiums. And Alice was mentioning, these aren't people who just voluntarily need to pay premiums. Many of them also have to have it because they have existing medical conditions that needed treated. And that is going to have a knock-on effect, presumably longer term. Can you just kind of outline for us what you think the ramifications of all of that is going to be?
Well, as your interviewer pointed out, and as you pointed out, not only are the premiums going up, but the deductibles are going up. So people who've kept their insurance on the marketplace are still going to have to pay more out of pocket. That means it's competing against their food, their rent, and these other costs, which are also rising. The net result is that we would expect people to sort of try to put off some of the health care. And that's unfortunate because in many cases, things that are preventable things where they feel a little chest pain. So maybe they should go into the doctor to get checked up. And they're going to say, maybe I won't do it. And so that leads to the increased risk that they have a heart attack or they have a much more serious problem. And that's why these effects are so deleterious for not only the people, but also for the healthcare system in general.
Alice, KFF, it's a non-profit health policy research organization. Back in May, it reported that the number of children who signed up for health insurance is now, or were signed up for health insurance, is now lower than it was before the COVID pandemic. What are the concerns about that?
I mean, it's the same concerns across the board that, you know, when a very important and very popular piece of Obamacare, the Affordable Care Act, is coverage for preventive health care. So, you know, getting a vaccine, getting a checkup, getting a mental health screening, things that not only can prevent much more serious health problems down the line, but also save both the individual and the government money. It's, you know, obviously much cheaper to prevent a major health issue than to, again, like Leighton said, wait until it's so, you know, dire and serious. And so when people don't have insurance, they then skip that preventive health care because it's no longer free. I'll say another factor that is really fueling this problem is the same bill that last year made a lot of these healthcare changes also stripped lawfully present immigrants of some of these same subsidies and pushed a lot of them out of the insurance market. You know, these are people who are here on visas, work permits, they pay taxes, they're here lawfully, and they tend to be both younger and healthier than the general US population. And so having them be out of the insurance risk pool is another thing raising premiums for everybody else.
And at the same time, as you say, the companies themselves will be raising premiums in order to be able to try to manage their costs, for want of a better phrase. Are there other ways, though, that you think that they might start adjusting the way that they approach treating people or allowing people to be treated in order to, again, try and offset what they might be losing in terms of the premiums from people who are not joining the system?
Well, there are a lot of different sort of stakeholders in this system, and they're all trying different things to try to, mitigate this crisis. So, for instance, you have some states that are backfilling the lost federal subsidies. New Mexico, for instance, has backfilled the entirety of the lost federal subsidies, even though they're quite a poor state relative to others. And as a result, they've seen way fewer people drop their insurance than in other states. So we're really having this sort of natural experiment play out across the country right now, and we'll be able to compare, what different states are doing and the impact of it on people. You also, like you said, have insurance companies that are having to grapple with this and make choices. Do we, what do we offer? What do we sell to our customers? You have hospitals also making these same choices, having to, reduce services, even close some facilities altogether in certain parts of the country.
It's worth bearing in mind, Americans paying out of pocket, they have also been subject to what was Trump RX, as it's known, which was an effort to try and reduce some prices of some drugs. And for Americans paying out of pocket, rather than through traditional insurance companies, well, we have been pointing out that the cost of several medications has come way down, all being part of a big push by the Trump administration. For example, let's take a look at some of these diabetes and obesity treatments. It wasn't long ago when an Ozempic pen would set you back more than $1,000. Now it's $200. Zepbound is another highly popular FDA-approved prescription weight loss drug. Again, that used to cost over $1,000. Now you can pick it up for $300. And Wegovy, which was around $1,300, is now available for $200. So this is an effort by the Trump administration to try to reduce the cost, although it's worth pointing out this is only available, I believe, to people who are able to pay the money in cash rather than be able to do it through any other system. Leighton, do you think that this is a way of alleviating the burden that we're seeing if people are moving away from healthcare systems?
It alleviates the burden for some people, but not for many. The costs are still going to remain high. And so for certain medications, and so to the extent that the Trump administration has been able to do this, in many cases, the prices that people were available to get through other sources, other private sources, were cheaper than those from Trump RX, and they remain cheaper. So Trump RX helped many people, probably has not helped enough, and the net loss is still negative. The other thing is really sort of it's things like people being able to get physician care, hospital care. That's where the real costs are. And so helping people get medications, that's great to the extent that the president has been able to negotiate some savings. That's appreciated, but it doesn't compare to the huge losses that are occurring in other parts.
Alice, Leighton mentioned right at the start of the show the fact that the Republicans seem to be very resistant to the idea of anything along the lines of Obamacare. I don't understand why that is. I would have thought that any government offering universal health care for a country would be a guaranteed vote winner, that you were going to get people who were going to support that. Why is that?
If you ask a lot of conservatives, it's akin to socialism, even though Obamacare is, largely relying on private insurance companies. It is not the, universal government health care that a lot of progressives want to see eventually in the U.S. It was sort of this middle ground, but now... And all along, it is seen by many conservative Republicans as too much government interference in healthcare. Although, again, there's been a sort of picking and choosing where they like some parts of Obamacare, like the coverage for people with pre-existing conditions, being able to stay on your parents' insurance until you're 26, things like that. But they don't like a lot of the other pieces of it. And, we've sort of seen after failing to completely repeal it, they've managed to chip away at it in these certain ways. And so now we're in this a little more precarious situation.
Leighton, we're only a few months away from the midterms. How much do you think this is going to influence the way people vote in that?
This can have a considerable influence for some people where this matters. The thing I'll add about some of these changes with Obamacare, the paradoxical element is the places where the premiums are going up the most, where it hurts the most, tend to be southern conservative states. They're states that failed to expand Medicaid, so we're more reliant on Obamacare. Because of that, we see the paradox that these states that are the heartland where the sort of conservative votes are, have suffered the greatest losses. Are they going to pay for this in the midterms? I don't know. That's a good question. One would think that this will hurt them more. But again, there's so many things going on in how people make their election decisions.
Alice, as I mentioned, you're working for Politico, so I've got to ask you, how do you think this is going to play out?
Yeah, so far it's sort of been wrapped into this bigger discussion about the cost of living becoming unaffordable. There hasn't been as much of a standalone healthcare debate as there maybe have been in past election cycles, but it's certainly part of this, I can't afford groceries, I can't afford gas, and I can't afford to go to the doctor. And people are really feeling that stress. And it's happening to these constituencies that Republicans really can't afford to lose. You mentioned the geographic hit, but also, it's important to keep in mind that this is hitting folks that, Republican voters that the party relies on, including people who are, early retirees, who are maybe in their 50s, early 60s. They're not old enough to qualify for Medicare, and now they can't afford insurance, and they're in an age range where they really need that insurance because they have these different health issues they're dealing with.
Yeah, well, it's going to be interesting to see. We've got 5 months of the midterm till the midterms are going to hit. We're going to be watching this as we head towards that. And of course, as we were talking about, this is going to be a very key element of the way that voters are going to be heading towards the ballots come November. We're going to thank our guests for today, Alice Miranda Ollstein, Senior Healthcare Reporter at Politico, and Leighton Koo, Professor and Director of the Center for Health Policy Research at George Washington University. That is all from us here in the studio. We're going to hand it back to Richard Gaisford and then Al Jazeera's global headquarters in Doha.
Thanks, Rob. On the next edition of This Is America, we'll be focusing on the enduring legacy of gun violence in the United States and the divisions caused by Second Amendment rights. Do they protect people or put them at unnecessary risk? That is Friday at 18:30 GMT, 2:30 p.m. Eastern here in the United States. For now, though, from Washington, D.C., it's goodbye.